The following information is presented for discussion and educational purposes only and is not intended or provided as treatment information for any specific person or behavior. If you or a loved one is having behavioral difficulties, you are encouraged to seek professional consultation as soon as possible. Ladies and gentlemen, welcome to episode 23 of Ask the Behavior Doctors. My name is Dr. Jacob Boney, and I'm here in Scottsdale, Arizona at Scottsdale Pediatric Behavioral Services. So today we're bringing you a question about traveling. And the question goes, Dr. Jacob, how do I possibly travel with my 5 and 8-year-old children? They always seem needy, irritable, at each other's throat constantly, and it becomes so stressful that my wife and I would rather not travel at all than deal with it. What can we do to make traveling easier? So I want to mark that flying is its own topic. I have addressed this with many patients, and I'm going to do my own video presentation about flying in and of itself. So we're just going to talk about like car trips, basic trips, things that don't involve flying. So my first recommendation here is I want you to be practical. The younger the child, the shorter the travel should be. It may be easier to have people actually come to you when your children are extremely young. Little tiny infants, it's hard to do cross-country travel. And I know that some people do and some people can, and that's great. And I certainly don't blame parents for doing that. But parents who experience such stress traveling with their children that they don't want to do it, I would recommend limiting long distance travels until your children may be a little bit older. Plan accordingly. I want you to have as many options and reinforcers and stimulation as you can. So remember, things that your children like, things that engage them visually, auditorily, think about headphones, iPads, anything. Rotate these items semi-frequently to prevent your child from becoming satiated and bored with the items. So remember, you need to have at least 5 to 10 items per kid that you think they're going to want to engage with. Keep children stimulated on appropriate items such as books, games, iPads, etc. These things will decrease their motivation to argue or fight with each other instead of focusing on the item. Keep demands low during traveling. Okay, don't give a lot of task demands, don't give a lot of chores, don't put a lot of responsibilities, especially on younger children. Their tolerance for it's going to be much lower, and their compliance level is probably going to suffer as a result. Your child may be stressed, scared, fatigued, and unable to manage their response appropriately in new and stressful settings. So that's another reason to keep those demands low. Dress yourself and your children comfortably. The easier it is to relax and be comfortable, the less likely you are to get irritable, argumentative, defiant types of behavior. Provide more drink and food access than typical to stabilize your child's blood sugar and caloric levels. Fatigue and hunger mixed are more likely to result in behavioral bursts or tantrums. So just consider that increasing temporarily that food and caloric intake. Try and keep one caregiver or a mature, responsible teenager on child duty at all times. I always tell parents, if you can predict the needs of your child and fulfill those needs, especially during a stressful time like travel, if you can do that preventatively, then you won't have to put out so many fires. Remember, I always tell parents, prevention is easier than crisis management. So if you have one person dedicated to caring for the young children at any given time, the more likely to fulfill those needs before the children even have to ask. Remember, that's when children scream, tantrum, fight, cry, do all of that stuff. It's when they're so frustrated, when they're so overwhelmed, or they're so irritated that they're using their behavior to communicate. Remember, if you fulfill those needs before they even have to communicate, you're much more likely to prevent any kind of sudden burst or change or shift in behavior, and you're much less likely to have children engaging in behavior intended to communicate those needs. Make sure the caregivers do take turns though, and make sure that while they're taking turns, the other ones are resting, preparing for their shift, looking after the kids. If your child is especially small, clingy, scared, or fearful, I want you to consider some sleep restriction and drowsiness medications. I've done this in consultation with many psychiatrists, many developmental pediatricians, especially for some of my severely impaired patients who literally have a panic attack when the threat of like flying or doing something like that occurs. Again, I know this sounds a little old school or a little maybe inhumane, but if this is the difference between you being able to travel with your child and not, it certainly becomes a more appealing option. So parents, do consult with your child's pediatrician, and obviously if you're going to do this, you might want to consult with a behavioral professional. But again, some sleep restriction and some drowsiness medication. If your child spends the whole trip being drowsy or being tired, especially if you can put them in a carrier, put them in a stroller, prevent their need to really be awake or to walk or to do any kind of physical exertion, you can get a lot of more behavioral consistency that way. And again, if your child's so tired that they're just spending the whole time sleeping, then they're probably not going to engage in a significant stress or tantrum response. So again, just kind of preventing that. I think that is the more humane option, obviously, to keep your child kind of drowsy and tired than to keep them scared and fearful the whole time. If you are driving, consider more frequent or planned stops to allow for physical output activities. Doing this can help to regulate your child's mood and energy levels and can prevent the likelihood of sudden behavioral bursts or disruptions. Pinning children up, especially several young children, in a small confined space over time is a recipe for disaster. You might want to plan those frequent trips and plan them so your children don't have to scream, cry, or tantrum to ask for them. If you plan them frequently enough to kind of allow them that physical output, allow them to get that energy out, they won't have to do it in inappropriate ways. Maintain a positive attitude, and this is one of the most difficult things to do as a parent. Obviously, traveling can be very stressful and fatiguing for you as a parent. Very few people are at their best as behavioral managers when they're traveling. However, if you plan accordingly and you maintain that positive attitude, you're going to set a good tone for the energy, for that emotional energy in the setting. Children are especially reactive to stress or uncertainty in their environment when they sense that parents are stressed or that parents are arguing. Acting stressed or angry in front of a child is more likely to produce irritable behavior from them. So even if you're not happy with your partner, even if you're not feeling especially happy, kind of putting on that face can certainly help set the tone for your children and make it more likely that they're going to regulate their behavior more effectively. Exhaust your children as much as possible before presenting bedtime, especially in a strange hotel or motel. Children have more difficulty adjusting to changes in their sleep environment. So if they're sleeping in a brand new place like a hotel, you want to exhaust them as much as possible. So let's say the hotel has a pool or has some kind of activity where they can get tons of physical exertion out. I want you to physically exhaust them. The reason I say this is that, remember, you're going to have to overcome that fear, overcome that uncertainty, overcome that discomfort of being in a brand new, scary, unfamiliar place. So to do that, you're going to want to make sure your child is especially tired. Here's the deal. If your kids are super rambunctious, super off the charts with energy, I probably wouldn't take them back to the room until they start to look or start to appear tired. Again, I'm trying to prevent problems for families. We're trying to give you recommendations that prevent problems in small, confined spaces. Plan to minimize time in the hotel room if the room is smaller or if you have multiple children in the room. Make one parent or one caregiver in charge of getting kids ready and out of the room as soon as possible. Have the other parent meet up with the family at a little bit of a later time. Again, by getting kids out and onto an activity, you can prevent that pent-up type of energy, and you can probably prevent a lot of behavioral outbursts. Remember, whenever you're going to have kids in a confined space for extended periods of time, you are asking for trouble eventually. So the sooner you can get them out of the space, remember, hotel rooms for kids should just pretty much be used for sleeping. Kids aren't going to find rooms very entertaining. So the quicker you can get them in and out of that room setting, the more likely you are to get some behavioral consistency. Parents, my last piece of advice is always remember the basics. You get the behavior you consistently reinforce. Stay positive. Put the emphasis on earning things instead of losing things. Be a giver, not a taker. Keep demands low and keep your prompts really efficient. Don't use a lot of words. Use just a few if that's all you need. Only prompt what you are willing to make your child do or enforce a consequence for not doing. You need to pick your battles and you need to let some things slide, especially if you're traveling. Give your attention to the best behaviors. Be the giver of good things. Okay? When you have that reputation on a travel, on a vacation, your children are going to be more likely to really try and impress you with their behavior and more likely to be in the mode of earning things instead of trying not to lose things. Ladies and gentlemen, that brings us to the end for today. I want you to please continue submitting your questions to us at info@scottsdalepbs.com. We want to thank our photographer, Mr. Philip Carnevale, at www.philipcarnephotography.com. We want to thank you again for submitting questions and joining us here at Scottsdale Pediatric Behavioral Services and Ask the Behavior Doctors.